Heather is a 22-year-old female. Her chief complaint today is that she thinks she has a bladder infection. She reports burning with urination as soon as the flow begins. This began 3 days ago. She first noticed it when playing volleyball in the sun in August and admits to not drinking enough fluids while playing. She has noticed increased frequency of urination the last 3 days, but thought it may be because she had been drinking a lot of water to treat the bladder infection. She denies urinary urgency, but says she has a huge bladder. She has noticed some vaginal irritation, slight vaginal discharge that may be white. She is not sure. She has a boyfriend that she is sexually active with. They use condoms sometimes, and recently used a different brand of condom. She takes an oral contraceptive and misses up to 1 pill per week, but no more. She denies recent antibiotic use. She has a past medical history of a bladder infection 2 years ago, chlamydia at age 16, a mole removed from her leg at age 12, PE tubes in both ears at age 18 months. She denies any chronic illnesses. She has a family history of hypertension and heart disease. Currently, she lives at home with her parents. She is taking a break from college. She works at Bob Evans as a waitress 3 evenings a week and babysits on the weekends. She smokes less than half a pack per day and has a boyfriend she is sexually active with. A review of symptoms: she denies any nausea, vomiting, diarrhea, and constipation. She admits to burning upon urination, urinary frequency, vaginal irritation, and slight vaginal discharge. Physical exam: general appearance: she does not appear to be in any distress. Her height is 5 feet 5 inches, weight 122 pounds. She has afebrile. Her abdomen is soft. She has mild suprapubic and lower quadrant tenderness bilaterally. Her test results: her urine dip shows large leukocytes present, specific gravity 1.010, with no other abnormalities. Differential diagnoses for Heather include chlamydia, gonorrhea, fungal vaginitis, cystitis, and pregnancy. I chose chlamydia because it is the most common STD in the U.S., and she does not always use condoms when sexually active. Some of the symptoms of chlamydia include vaginal irritation, discharge, and urethral syndrome with dysuria. She is exhibiting these symptoms, and I think this is the most likely diagnosis for her. I chose gonorrhea because in up to 45% of cases, the patient also has chlamydia. I chose fungal vaginitis because Heather's symptoms of vaginal irritation and discharge, and her predisposing factors of oral contraceptives and increased perineal moisture from playing sports. I chose cystitis because she has a history of a bladder infection, and some of her symptoms as well indicate that. I chose pregnancy because it may be likely with her missing doses of oral contraceptives and not always using condoms when sexually active. My plan for Heather would include a pelvic exam with STD testing, cultures for fungal, and a urine pregnancy test. Case 2. Joe is a 17-year-old male who presents with a chief complaint of an itchy rash. He's had the rash for 2 weeks, and it has spread to his entire trunk and thighs. His mother recently switched detergent about a month ago, but no other family members seem bothered. His mother denies a rash. His brother reports some itching but no visible rash, and his girlfriend might have some bumps, but she is not quite sure. He went camping 2 weekends ago and may have been in contact with some poison ivy. He did get some bug bites at the campout. His mother also says that it has been a bad year for bugs in their yard, and she cannot go out without first applying bug spray. He plays football and wrestles. He is on 0 medications, but he took a leave a couple of weeks ago for muscle soreness from football. He's not sure if he's ever taken a leave before. This may have been the first time. He has a past medical history of eczema, but has not had a breakout in a couple of years. No history of asthma or surgeries. Joe lives at home with his mother and brother. He attends the local high school and is in the 11th grade. He plays football and wrestles. He has a girlfriend and smokes half a pack per day. Review of symptoms: Joe denies fever, illness. He also denies runny nose, sore throat, coughing, wheezing, and shortness of breath. He admits to having aching muscles a few weeks ago, and he has a rash on his trunk and thighs. Physical exam: height 70 inches, weight 176 pounds, temperature 98.2, pulse 64, respiration 16, blood pressure 92/50. The exam shows a fine maculopapular red rash on trunk that is widely scattered, extending a little bit onto the thighs. There are several slightly larger bumps at the waistline. No bumps noted between fingers. No visible rash in the antecubital areas or on the backs of knees. The differential diagnoses for Joe would include contact dermatitis, atopic dermatitis, drug eruption, and I also considered chickenpox, ringworm, and bug bugs, but did eliminate those Due to Joe's age for chickenpox, the rash did not exhibit in the typical ringworm pattern, but I thought it possible with playing football and wrestling. And then I also eliminated the bedbugs because the rest of the family would also exhibit bumps if they had an infestation. I think it is most likely that Joe is suffering from contact dermatitis, from possibly the detergent change or poison ivy, because there's a minimum of 10 days required to develop a sensitivity to a new contact. It is most probably the laundry detergent, with the rash being on his trunk and larger bumps at the waistline where his pants and underwear would be. And it is also likely since no one else is having a rash as well. I chose atopic dermatitis because that normally begins with intense itching, which causes the patient to scratch, which results in a rash, and with his history of eczema. This is chose drug eruption because it commonly exhibits with a maculopapular rash on the trunk and extremities. It usually appears 1 to 4 weeks after the initiation of a drug, and that can occur with NSAIDs. And with him just beginning the Aleve, this is also possible.